Hi, everyone. I'm Dr. Swanson alongside Dr. Vanyarachi, and we're from KSB Foot and Ankle Clinic. And we're here to present tonight on the connection between our feet and heart. We'd like to thank KSB Community Wellness and Aaron Fox for putting this presentation on this evening. And with it being February and American Heart Month, we thought it would be good to cover the connection. And hopefully we can give you some information and some advice going forward. So some of the topics we'd like to discuss this evening is why is this connection important? Risk factors, clinic exam and what we are looking for on a day-to-day basis, signs and symptoms of good circulation versus not so good circulation in our feet and legs, various treatment options, and then we'll cover some prevention as well. So I'd like to turn it over to Dr. Vanyarachi at this time.
All right. So why is the connection so important? Well, the same vessels or your arteries and veins that are in your heart will travel down to your legs. So if there's ever a blockage within that connection but from your heart to your legs, that can cause reduced or compromised blood flow. This means that you would have some trouble healing wounds. It might take a little bit longer. You might notice that your legs will swell up a little bit more, and you might even notice some pain. It's important that we identify these things because it may be that you need to have a further workup from our cardiology department. It's good to know also this connection because having a decreased connection with this blood flow could lead to, potentially having a serious infection that can be further complicated by amputation. Some of the risk factors that people might have with reduced blood flow would be being a little bit older, having diabetes, having a history of smoking, a poor diet, and not exercising enough. So from our standpoint in doing clinical exams, some of the things that we evaluate for in regards to your blood flow to your feet, we look at skin color changes. We look to see if your feet are, the color of your skin, or are they more blue in color or white? We also feel for the temperature to feel if it's warm or if it's cold. Another thing that we look for is to see if there's hair growth at your toes, to see if there's, that good blood flow that we're looking for. We'll also check your pulses on your feet. So you have, two major vessels that are running in your foot itself, which is your dorsalis pedis on the top of your foot and your posterior tibial, which is going to be on your inside of your foot. You also have your popliteal and your femoral artery, which are going to be popliteal being behind your knee and your femoral being up near your groin. So some signs and symptoms of good circulation. So when we're palpating for your pulses, we'll be able to feel, that good steady pulse. We also won't notice any swelling or what we call edema. Your feet will be nice and warm. And then when we are checking the tips of your toes, we'll see that the color returns to your toes quickly. You really won't have any trouble healing wounds if you have good circulation either. And activity, you will be able to perform, most of your exercises without being in pain or have any pain in the back of your leg or calf pain when you're walking.
All right, thank you. So now we're going to cover some of the not so good signs and symptoms. So things we may experience with reduced circulation is if we cannot feel one of those pulses in our feet, if the feet are cooler to the touch, or if there is an imbalance from one foot to the other. When Dr. Vanyarachi mentioned pressing on the tip of the toe and seeing if that skin pinkens back up, if we notice that that time is delayed, that can be a sign as well. Skin discoloration. So in that top photograph there, you notice that brown pigment. That is called hemosiderin deposition. And what that is it's blood that has worked its way to the surface of the skin, and through the oxidizing process, it now is a brown pigment. We may have calf pain with walking, so you may notice that you may only be able to walk a block or two or a certain time, and then you start to get some cramping in the back of your calf and you need to sit down and rest, and then you can proceed with further activity. You will notice swelling or edema. There's non-pitting and then there's pitting edema. Non-pitting is when you push on the foot or leg when it's swollen, and then you let go, the indent does not stay. With pitting edema, that indent will stay, and the longer it stays, the more significant the edema is. Varicose veins, they can be an issue as well, and then there can be delayed time with wound healing. And any wound that is open for a longer amount of time poses a risk of getting an infection and worsening condition as well. And one emergency with reduced circulation is if you ever have rest pain in your calf muscles or in your foot or leg. And what this means is if you're sitting and you have extreme pain in that lower extremity, and we see some of these other signs and symptoms, it is very important to have that evaluated because we could be having a condition called critical limb ischemia, which is an emergency. So treatment options. Further testing to evaluate for good blood flow involves using a Doppler, which we can use in the office, and we can listen for pulses. We could also order what are called ABI or an ankle brachial index or toe brachial index segmental pressure evaluation. This is where blood pressure cuffs are placed from your thigh all the way down to your toe, and also one around your arm, and then the calculations are made to evaluate the blood flow and compare from side to side in your lower legs. Venous insufficiency exam will evaluate for the veins, so the blood flow from our feet up to our heart, and this will make sure that the veins are working properly. We have what are called valves in our veins, and that helps the blood flow to keep moving towards our heart. And if they are not working properly, the fluid and blood will get stagnant, and that can cause more swelling. Like Dr. Vanyarachi also mentioned, cardiology referrals are very important if we see alarming signs and symptoms. We have a great cardiology department, and they will do a systemic evaluation, checking out your heart and even your lower legs as well. And if they feel appropriate, further testing may involve an angiogram or venous ablations. Prevention. So always checking your feet regularly is always a good thing to do. If you notice anything of those signs and symptoms that arise, the earlier we can address them and treat them, the better chance to heal them is what one of our goals is. Cardiology referrals, if we feel it's appropriate, we will definitely get you set up with one of our cardiologists. Proper wound care, like I mentioned, treating wounds soon and early. We want to get those wounds closed up as soon as we can. Healthy diet and exercise. We can't stress enough how important a healthy diet and getting up, walking around, and exercising can be for our circulation, both in our legs and our heart. And early treatment is always key. So in conclusion, there is a very important connection between our heart and feet. It is very important to also identify the signs and symptoms early. Any wound that you notice in your lower extremity that you may be having trouble healing, there could be an underlying component to this that we can help address, and it very well could be due to blood flow. The source of any signs and symptoms may be more systemic, and this is where that cardiology referral will come in very helpful. And like I had mentioned earlier as well, early treatment is key. But we'd like to thank you for joining us tonight. If you happen to have any issues regarding your lower extremities, regarding blood flow, we are more than happy to take a look and evaluate you. We hope that some of this information can be useful as well. And we'd like to thank everybody for joining tonight, and KSB Community Wellness and Aaron Fox. And we hope to see you next time. Have a great night. Thank you.